Hi. Okay, I guess, where should I start? From the beginning. I still get emotional about it. When I would say, 9 months ago, I tore my meniscus on my right knee, and then my left knee started giving me problems, and I went to a knee doctor, and they said that I needed knee replacement surgery because I have osteoarthritis on both knees. And when I went to get an MRI done, I found more problems with the knees, and I can't go into detail exactly what it was, but they also found osteoarthritis in my lower back, and they said there's no way that we're going to be able to do anything for you, you have to get your knees replaced. And so I thought, wow, I'm a dancer, okay, I am a salsa instructor, and I teach dance for a living, and I'm a professional dancer.
So just for the record, I'm going to put her on blast a little bit. Edie is one of the world's top salsa instructors. She's being very modest. I've gone to her classes, but go ahead.
Yeah, so I teach salsa. I've been teaching salsa dancing for 25 years almost. And this would have been basically really career killing. And I thought, I cannot do this. I'm too young to have my knees replaced, especially after finding out that they only last pretty much 10 years. And after 10 years, either you have to get it redone or there's always complications. And I'm only 53. And so I guess I banged up my knees so much, dancing all the time, going to many different places, that I have the knees of a 70-year-old. So a friend of mine who saw me limping around, she's a Zumba instructor, she had referred me to a place here in Colorado that does adult stem cells, and that's where they take the stem cells from your back hip area near your spine, and they pull that bone marrow out, and then they inject it into your knees. Well, my mom was there when they did it, and well, first of all, it cost upwards of 10 grand, and I was just, I had to do a GoFundMe account in order to raise the money, because I just didn't have the money to do it, and this was I thought my only option. And so I went there. There wasn't really too much pre-screening. They just said, okay, they looked at my MRIs, and they said, yeah, you have this, and this wrong with your knees. We could probably get it done, but at your age, we don't know if it's really going to work. And I just kind of took that risk. So I went in, and they did it. I was on the table for, I would say, it had to be well over an hour.
Now that was them drawing the bone marrow and injecting, or?
Okay, they took the bone marrow first.
Okay, a different day?
In the morning.
Oh, in the morning, okay.
That wasn't a problem. In pulling the bone marrow out, I felt almost no pain compared to them injecting the stem cells. My mom was there, and I was videotaping the whole time. I still have the videos. They allowed me to videotape the whole thing, and she videotaped as well. And she said that the needles were like the size of a knitting needle. And she couldn't believe it, because she wanted to have it done. But after she saw what I went through, she completely said no way. And I was there, and I remember laying on the table, the tears were coming down my eyes, and I couldn't believe how bad it hurt.
Just from the injection?
From the injection. Now, what was interesting is they put PRP injection into my left knee, and they put stem cells into my right knee. The PRP injections didn't hurt as bad, and they did maybe about, 50 or so injections, and it had to have been that because they kept injection, and I could see the ultrasound, and they kept injecting. It just felt like it was just a never-ending process, and so when they put the PRP in the left knee, it didn't hurt as bad, but when they put it in this actual stem cells, because it turned out at my age I didn't have enough stem cells. I needed 500 million or something like that for both knees, so they could only do my right knee, which was the worst. And then when they injected the right knee, the pain was unbearable. And they asked me if I wanted to be put out, but I couldn't. They said it wouldn't be good, because if I put drugs into my system, then the stem cells would be affected like that, and it wouldn't work. So they put a topical numbing solution like Novocaine on top of the knee, but they couldn't really they couldn't really get rid of the pain. So then after it had to have been an hour and a half on that table, I finally got up. I could barely put my shoes on. My mom had to come over and put my shoes on for me, and I had to be wheelchaired out. And I remember crying because it just hurt so bad. And
How long did you have your pain for? That pain.
Okay, well, this is the
Which is the pain caused by the procedure.
Right, okay. So that pain, which was interesting, they recommended that I take 2 Percocet afterward.
Okay.
And so my mom told me, she said, why don't you just take 1 or even a half? Because my mom's a nurse, okay? Or she was a nurse, now she's retired. And so I took 1 Percocet, and I'm allergic to Vicodin, okay? And I didn't realize that Percocet is part of the Vicodin family, and I guess nobody else realized that too. It's also part of the morphine family, so I'm allergic to any opiate. I found out later on because when they wheelchaired me out, the pain was so unbearable, I took the Percocet. 30 minutes later, they called a shuttle bus for me because we were staying at a nearby hotel that they recommended that I stay at because I could not drive, I could not walk. My mom had to they had a big guy there carry me from the wheelchair and put me inside of the shuttle bus, and then he had to pull me out of the shuttle bus.
Wow.
By that time, I was barely awake because of the Percocet, and when I got inside of the elevator, or right at the elevator door, I guess I passed out, and my mom, they were waiting for the elevator and it was stuck or something, and she looked at me and she said, Ita, you have to get up because we're going to get on the elevator now. And I was still in the wheelchair, and she pulled my head back and my whole face was gray and my lips were purple and I would stop breathing. And so I guess that's a severe allergic reaction to Percocet is death, right? So I died. My mom asked anybody if they could call an ambulance or somebody, if anybody knew CPR, and she's in her late 70s and she can barely do anything, but I guess her daughter's dying, right? And so she started to hit my chest and to give me CPR mouth to mouth, and I finally came back to, and she said I was out for at least 4 minutes, and if they would have waited for the ambulance, I would have been dead. So,
wow.
I guess they didn't bother to check that, and so...
The place that you got the stem cells at.
The place that I got the stem cells from, right. And I didn't even know, when I said I'm extremely allergic to Vicodin, they probably should have known that Percocet is like Vicodin or worse.
So fast forward past that experience, did you ever hit a point where you got some pain relief from the adult stem cells, and if so, how much?
Okay. Well, wait a minute. I had to stay in that hotel for 2 days. Actually 3 days, because I was in so much pain, okay? So we stayed a total of 3 nights at that hotel. I didn't even go downstairs to see the pool, nothing, because I could not walk.
Okay.
I was in so much pain that I didn't even want to use the restroom. I did not use the restroom for 16 hours. I couldn't even go to the bathroom, and my mom was telling me, you have to go to the bathroom, And so I ended up staying there for the next 2 days, because it was just so painful to even move in bed one direction or the other, Sorry, I'm getting all emotional. It's like I'm reliving this thing.
It's okay.
Nightmare. I'm reliving this nightmare.
So if we pass that, a week after that, how was your knee?
Okay, let's see. A week after...
Or 2 weeks after, or really any period after?
I would say, I have this on my YouTube channel. What happened the day after Okay, so if I go back and I remember, a week after, I wasn't feeling any relief. It was still hurting me. And then about a week and a half, maybe a week and a half later, it was starting to feel better.
So you definitely did start to notice something.
I started to notice something for sure.
What was the best point you say you got?
After I was still limping around for 2-3 weeks after that. I was still limping. I was still on crutches.
You couldn't dance, right?
No.
I think I remember you telling me that.
I was training my instructors, but I was sitting down and telling my advanced instructors to train the newbie instructors. That was all I could do. I did not teach any classes, nothing. I would say maybe 2-3 weeks after I started to feel good, I started to feel a little bit of strength in my knee. I could move it around, and then a month and a half later, I started to feel a little bit more and more strength, and I started to walk, not normally, but I still had a limp. There was still like this crumbling, this paper bag crumbling in my knee that I could not get rid of, and I could only walk. Going up the stairs, I could only do one leg at a time. Going down the stairs, one leg at a time still after 1 month. After 2 months, I started to feel semi-normal again. I was starting to feel 70%. Then after 3 months, maybe 80%. After 4 months, 90%. 5 months, 95%. And then when I was dancing, just showing one single move where I turn right, where I turn left, and then I turn right. And it was just like walking, going left and saying, oh, I changed my mind, I go right, and all of a sudden, bam, it went out again. Start over from the very, very beginning. And so it was like as if I had not done anything. And I thought, okay, I'm not going to walk on it, I'm not going to do anything for 2 or 3 days and just see what happens, and it never got better.
And so with all that experience, overall, what was your... what would you say about your experience with adult stem cell therapy?
It was a waste of money and a waste of time.
And you came across amniotic later on, yes?
Yes, I found out that Denver Spine and Posture, Dr. Jones, was offering amniotic stem cells, and I was really hesitant on doing the amniotic stem cells because of all the crap they talked about amniotic stem cells. They were, the people over there said horrible things about amniotic stem cells, that there was baby urine, it's just water they're selling you, you don't know if the stem cells are alive, you don't know what you're getting, you don't know who you're getting it from, and you know, they feed you all this propaganda as if even if you think about it, you know, it's just sacrilege, you know, and I was so convinced that amniotic stem cells were just the worst thing in the world after that.
Did you attend one of the lectures?
One of the lectures for amniotic stem cells?
Yes, one of the lectures with Dr. Jones.
Yes, I attended a lecture that Dr. Jones had given. He had invited me because he was performing, I was a patient of his performing advanced biostructural correction, and he said, hey, I'm doing a lecture on this, and I said, okay, I'll go. And I didn't really want to go. I was just going to do it just because he's my friend, and I thought, okay, you know, I'll just go because he's been a good doctor for me for 2 years, you know, I'll go. And then when he started talking about...
Go ahead.
Then when he started talking about it will actually repair cartilage, and he started saying all these wonderful things about it, and then I saw the testimonials, and I thought, you know, why are these people talking so much junk about this when, you know, you're seeing these results? And so I thought about it, and I thought about it for about 3 months, and I got tired of limping. I got tired of being in pain. I got tired of not being able to dance or to teach, and one morning I got up and I said, I'm going to do this. You know, I didn't even tell my family. I didn't tell my husband. I just came over to Dr. Dean and I said, let's do it, you know.
And for the record, we're talking about me. I'm not exactly sure why we're talking about me in third person. But anyways, so let's talk about your experience of getting the amniotic injection.
Okay. I can't even tell you how wonderful the experience was. It was just, I said, okay, I call him on the phone. I said, Dr. Jones, what, you know, do I have to get my mom to drive me home? You know, I could have to schedule. He said, no, you can drive yourself home. And I was really apprehensive over what I'd gone through before. Because these, you know, what they didn't even tell me that I shouldn't ice it afterward, or they didn't tell me how to take care of it afterward. They just kind of like did the procedure and gave me no follow-up. They gave me a few follow-up emails like once a month to see how I'm doing, but nothing after the procedure. Either they forgot, or I don't know what happened, but they just said, okay, we did you paid your money, go. And I'm not the first person that has complained about that, you know. So anyway, I asked Dr. Jones, I said, okay, I'm going to have to get my mom to drive. He goes, no, you can just drive yourself home. And I was like, really? And then he said, yeah, it's just an injection and then you go home. And I said, okay. So I came over, and all they did was they just cleaned me off. They had the screen there to show where the needle was going to be placed in. I had x-rays done first, and it's bone on bone, and there is actually a bone spur on my kneecap and the whole nine, and every time on the bone spur, every time I would make a walk, would dig into the muscle, and that was causing so much pain. And it felt like a knife every time I stepped. And so anyway, I was expecting all this pain, and I looked at the size of her needle, and it was only this little tiny needle. It wasn't a big knitting needle, you know, literally. I mean, look at this pen, right? This is what they used.
Yeah.
Okay, so anyway, so it was a little tiny needle, and she just injected it, and it was just a little prick, right, like you're getting a flu shot. And she goes, okay, you're done. And I said, that's it? That's all? And she goes, yeah. And I said, okay, whatever, this is never going to work, right? No pain, no gain type thing, right? And
No.
so I just went on my way, and within 5 minutes of her injecting me, I was like, I feel no pain. And what I think it was is because the fluid went in between the bones and actually provided a cushion for a while, because that whole day I was in seventh heaven. I was like, oh my gosh, I can walk normally. This is unbelievable. And then the next day when the fluid, I think, or the next day and the next couple of days, the fluid, I think, went down a little bit. It started to hurt just a little bit more. And I thought, oh, see, it doesn't work. And then 4 days later, it started to feel better. And then 5 days later, then 6, then 7. And ever since then, it has consistently gotten better every single day. And I am just so impressed with the amniotic procedure. I cannot even tell you. It is night and day compared to the bone marrow procedure, by far.